And it is my pleasure to introduce Dr. Eben Strydom. Born and raised in Namibia, Dr. Eben Strydom was exposed to rural healthcare in his sparsely populated home country. After graduating from medical school and working at a hospital in South Africa, he did a 2-month winter locum in Redvers. That convinced him to look further at opportunities here in Saskatchewan. He moved to Melfort in June 2003 and provides full-service family practice, including obstetrics, anesthesia, surgery, and palliative care services. He has served on the Kelsey Trail Regional Medical Association and the SMA's Board of Directors. He was elected president at the 2021 Spring RA. Dr. Strydom.
Thank you, Dr. Viswanathan. Good morning, colleagues, guests, and visitors. Welcome to the 2022 Spring Representative Assembly. This is our 5th virtual RA, and I know we are all tired of virtual meetings, but the Board of Directors thought it prudent to have a virtual meeting given that the pandemic is not over yet. The decision to proceed with a one-day RA and annual general meeting was also guided by member feedback on virtual meeting fatigue. The annual general meeting is being held as part of today's activities. But before I begin my address, I'd like to propose a moment of silence for all of us to acknowledge the people who we've lost to COVID-19. Thank you very much. This is my last address as president of the SMA, and I think the best place for me to start is actually at the end with most recent news released from the SMA. I'm speaking about the results of a recent member survey which we did in February. I released the results to the members last week, and the story has been in the news lately. Shortly after the onset of the COVID-19 pandemic in May of 2020, the SMA surveyed members about the pandemic's impact on physicians' work and health well-being. Earlier this year, the SMA issued a follow-up survey posing many of the same questions asked in 2020. Nearly 400 physicians responded, and the results showed the profession very much on the edge because of the COVID-19 pandemic, and 3 main themes emerged from this. The first point points to the need to bolster physician health and wellness efforts. Many cited health and wellness as one of the top 2 priorities. Half of the survey respondents stated their mental health was worse now compared to pre-pandemic. This is not surprising, and the survey confirms what I have been hearing from SMA members during my presidency. The medical profession is stressed and tired, and physicians have reached a limit. The second theme is that of physicians who want to be heard. This is especially true as we move forward and as the Ministry of Health and the Saskatchewan Health Authority begin to plan the recovery of the post-pandemic health system. Again, this is not an entirely new finding. The SMA has advocated for a stronger voice in the management of the healthcare system. We've had some successes, but during the pandemic, the physician community sometimes felt ignored. Finally, we heard that physicians want change. And I must say here that if the medical profession, together with the Ministry of Health and other stakeholders, don't make changes, there will be negative consequences. For example, nearly two-thirds or three-quarters of respondents indicated now they find practicing medicine less satisfying than before. Physicians have also a more negative perspective on the fee-for-service model, a thing which is emerging not just in Saskatchewan but across the country, shows the need for the reform of primary care structures, compensation models, as well as approaches to recruitment and retention of physicians and other healthcare occupations. The survey results are troubling. However, I think we are faced with an opportunity. Last week, as we announced the survey results to the public, I wrote to leaders of key stakeholders in healthcare to encourage engagement with the SMA on the implications of these results. I hope these leaders join the SMA in the search for sustainable, collaborative solutions in the weeks and months ahead. The coming year will also be busy in other respects. Equity, diversity, and inclusion continues to be a priority for the SMA, and the EDI committee has been looking at options and opportunities to create positive change. Much of the EDI work is made possible through funding from Scotiabank, MD Financial, and the Canadian Medical Association as part of their Physician Wellness Plus initiative. This initiative addresses the urgent ongoing health and wellness needs of our medical community. We are grateful for this sponsorship. The SMA is assembling its committee to represent you at the Medical Compensation Review Committee negotiations. Now, this is the forum where negotiations take place with the Ministry of Health on compensation and related programs. I think we are in for some tough discussions, but that's just part of the process. I'm grateful to have a strong channel where we can direct and hopefully address concerns of importance to physicians. The Medical Staff Association Revitalization Project has been moving along, and I feel we have fostered more effective activity and organization at the regional level. The SMA is stronger when everyone works together. The regions represented by the MSAs will be critical to tackle some of the issues generated by the pandemic, such as backlogs and staff shortages. The SMA also undertook a robust review of its governance practices in the last 5 months. Today you will hear an update on the work of this 5-person committee, which the RA elected to do this work. Governance may seem far removed from the day-to-day concerns of physicians, yet our strength and effectiveness as an association rest on a healthy and sound governance practice. My term as president ends today after delegates elect a new president. A new leadership team on the board of directors will carry on the work of the SMA. I wish to thank you all for what you do each and every day. Our journey over the last year was challenging, but hopefully we've weathered most of the critical part of the storm. I remain optimistic for a better and brighter future. Thank you again from the bottom of my heart and best wishes. I also want to thank my colleagues, hospital staff, patients and community members for their support and advice. And a special thanks to Shelby, who has kept me on track during this busy and challenging year as SMA president. And finally, I want to extend my heartfelt and special thanks to my wife, Marianti, my sons, Okat and Leon, for their support on the home front. I could not do this without your help, support, and patience. Enjoy the RMA. Thank you.
Thank you, Dr. Strydom, for your address.